This conference will now be recorded.
Welcome in, everybody. So we're going to be discussing air splints in this specific segment, talking about proper application and then indications and contraindications. So first, indications, we have a musculoskeletal injury to one of the extremities. This is where we're going to be utilizing air splints or other type of splints. But for this segment specifically, we're talking about air splints. So if you haven't done so, please watch the introduction to splints prior to watching this. As you can see, the air splints come in a variety of different sizes utilized for either the legs or the arms. So this is the boot style air splint. I got my patient. We're going to say that they fell from a ladder. Patient's alert and oriented. I conducted my trauma assessment and I've identified that this patient's got a left ankle injury and a left arm injury. I got my BSI on, my scene is safe, conducted my assessment. Now I'm checking the ankle, okay, ankle seems soft. There's a contusion there, patient's complaining of pain at this point. So you notice that these specific shoes do not offer any type of ankle stability. So what I'm going to do is I'm going to remove the patient's shoe very carefully. This is going to probably cause them some type of pain. Now, if you have a patient who has a substantial boot on already, so big work boots, something along those lines, you can go ahead and leave that boot in place because it provides quite a bit of stability from that. I'm going to go ahead and apply my splint. Check CMS. CMS is good. Make sure that that is all the way in. Zip up your air splint and now take your air hose. Make sure that you're nice and snug inside. And then start pumping. This generally takes a little bit because you got to pump quite a bit of air into there. You can see that it's starting to fill up, it's starting to form around that patient. Meanwhile, I'm going to be talking to my patient too, asking if they're feeling any relief at all associated with the splint. And then also, once I get to that end where it starts to get really inflated, I want to make sure that that patient still has proper CMS. Now with this splint, you notice that I can't actually check for a pulse. So what I'm going to do is I'm going to ask my patient, can you still wiggle your toes? Can you feel me touching you? Yes and yes. All right, that splint is properly located. And now I'm going to go ahead and apply the arm splint. Same technique, it's got a zipper application. So I'm going to go ahead, check CMS on the patient. CMS is good. Apply my splint. They have a forearm injury. I've identified that. There's no bleeding or anything associated with it. Go ahead and zip it up. Take your air hose. Make sure that you get a good seal with that. Put enough air in there in order to stabilize that specific extremity. Recheck CMS. Can you feel me touching you? Go ahead and wiggle your fingers. and then go ahead and do your pain assessment as well. So we identified that patients experienced an 8 out of 10 pain on the ankle, 8 out of 10 pain on the arm. After we've applied those splints, go ahead and reassess their pain value. Has your pain changed at all? That does it for air splints. So the splints will go ahead and go with the patient to the hospital. Oftentimes what will happen is they'll go ahead and remove those air splints, decontaminate them, and then place them in the EMS closet within the hospital setting so that you can reuse those. All right, thanks everybody. That's ear splints.